Her name is Lalita Padmini. The 1st of July 1998 was a very special day in her life. It was the day on which she received her appointment as a public health midwife in the remote village of Madagama in the poor rural outback of Dimbulagala. She worked at the Giripokana clinic in Madagama. It did not take her long to win the hearts of many people in the village. This was due to her charming manner of communication with people, her conscientiousness and commitment. At the time, the Giripokana Central Health Clinic was in a poor state, and conducting clinics was difficult and hazardous. Lalita decided to revive the Giripokana clinic, give it a facelift and a new lease of life. She made this her main objective. Her day's work commences in the early hours of the morning, with making breakfast and lunch for the family. While attending to her children's needs and overlooking their studies, she also provides her husband with all the support and encouragement in his activities. She conscientiously performs her responsibilities and obligations as a housewife, which makes her a loving mother and wife. She sets out early every morning on her bicycle, enjoying the fresh morning air and nature's beauty on her journey to her workplace several miles away. Her head filled with fresh ideas for a new day and the various duties she has to perform on the day. First to arrive at her clinic, she commences work in efficient manner. Her small but very neat and tidy room in the clinic is very attractive. Several posters prominently displayed in the clinic provides the clients attending with all the health education messages, information and instructions they need to know about its functions and all the services available to mothers and children. This is a very useful service initiated by the midwife for all those who attend the clinic. The midwife performs her daily functions in a spirit of love, kindness and affection to all. She endears herself to people and they treat her as a member of the family.
මව්තිය පෝෂණය කරන්න නම් අපි දැනගත යුතු කරුණු කාරණා කීපයක් තියෙනවා. විශේෂයෙන් දැනගන්න
Her charming style enables her to impress people and win their confidence, which helps her to inculcate in them the virtues of many different health-related habits and practices. developing the community's talents, knowledge and behavior patterns as a means to achieving a lifestyle that's best suited to the entire village is her ultimate objective. Besides the provision of maternal and childcare services, Lalita has used her creative talents to motivate mothers to encourage creativity that's most appropriate to their children's activities, which would also help in developing the child's brain power.
The thing about PHM Lalita Padmini is that she is always ready to give her support and willingly accept new responsibilities. So whenever a new program, special clinic or a project comes, and I can always rely on her because she is always willing to accept new responsibilities, and that is a very good quality I have seen in this PHM.
Midwife Lalita has also used her creative talents to devise a method by which mothers could monitor the nutritional condition of their babies. Her initiative ensures that mothers are committed to taking measures to restore normal weight to underweight babies. For this purpose, she has produced a series of colored charts depicting the progress of the children's health condition. She has divided the children attending the clinic into groups, and every child's name is shown on a chart with their weight indicated in different colors. A unique feature of this operation is that parents have been assigned the responsibility of pasting the appropriate color against their child's name. This enables parents to compare their child's weight with that of other children and thereby get an indication of their child's nutritional condition.
ජනතාව එකතු කරලා ඇය හිතුවා මීට වඩා සේවාවක් මගෙන් වෙන්න ඕන. මම පවසාවක සේවා නිලධාරිණියක් හැටියට මගේ සේවාව කොයි ආකාරයට දෙන්න ඕන කියන එක ජනතාවත් එක්ක එකතු වෙලා කතා කරලා ඇය හිතුවා මේ අයගේ පෝෂණ තත්ත්වය කියන්නේ ගර්භණී
Among her record of achievements, the clinic with the best immunization coverage, best nutrition status among children, 0 teenage pregnancies, 0 maternal deaths. It was an era when they faced the constant threat of terrorist attacks in a poor remote area where she fearlessly served an entire community in exemplary fashion. She helped the community with their health problems as well as settling their domestic issues, ever willing to offer a word of advice as a trusted friend. Every home in the area, no matter what time of day, she served the people with a rare sense of commitment. This was what earned her wholesome respect from every member of the community. She gave her spotless white uniform a new dignity.
She has a lot of intersectoral coordination. It's a marvelous feature of she's having that she has good coordination with other government officials, at the same time non-government officials. Wherever I see her with her happy face in her family life, at the same time in her work, and she has attended to, in a national level, she has attended to improve PHM curriculums, and she was a resource person at that time.
Her outstanding service earned her nomination for several awards. She has won both local and international awards. She also won the Asia Pacific Action Alliance for Human Resources Award, which is in special recognition of her services as a public health midwife. The many awards she has won have been in recognition of her dedicated service to the community, her sacrifices and commitment. While appreciating the recognition this award brings her with humility, it also gives her a feeling of innocent pride, which she shares with all those who contributed to her success. All those nice people whose kindness and goodness she will always remember. And she will be remembered as an outstanding woman who was the pride of her village, her country, and indeed the world. A great role model for people everywhere.